As monkeypox cases continue to surge in Africa, with statistics showing a 160% increase in reported incidences, the World Health Organization has said it is considering declaring the outbreak a public health emergency of international concern. And with Zimbabwe's neighbors, South Africa and Mozambique having already reported cases, leading local public health analysts have urged the government to enhance the country's surveillance systems.
South Africa and Mozambique have already registered cases and deaths, prompting local public health analysts to urge government to enhance the country's response systems in order to interrupt disease transmission in the event of an outbreak.
Unfortunate as it is, monkeypox is a public health threat in the region. And as Zimbabwe, what we have to do is we must consider enhancing our surveillance systems to enable us to quickly detect this disease and also respond to it. Since we have also experienced monkeypox in our neighboring countries, it is also an opportune time also for Zimbabwe to learn from these countries in terms of how they are managing this disease. We can also share this health intelligence to also help us as Zimbabwe to better prepare for any outbreak of monkeypox.
Since the beginning of this year and as at the end of July, a total of 14,250,000 cases were reported from across 15 African Union member states. Out of these, about 2,750 were confirmed and 11,500 suspected, while 456 deaths were recorded from 8 African countries. This represents a 160 and 19% increase in the number of cases and deaths respectively in 2024 compared to the same period in 2023. The World Health Organization has since warned of a more deadly and highly infectious Mpox strain spreading across Africa and other parts of the world, hinting on a possibility to declare the disease a public health emergency of international concern. Matorwa also called for heightened public awareness to help educate citizens, especially those traveling to infected regions, on how to protect themselves and prevent importing cases.
We also need to invest a lot in raising awareness, public awareness, in terms of the nature of this disease. What are the symptoms? How does it transmit? And what is it that people need to do in order to prevent it? But above all, what is very important as well in our response is to ensure that our medical facilities, their capacity to diagnose is enhanced, so that we ensure that our testing capacity is also increased. This will help us in terms of detecting new cases associated with monkeypox.
Mpox was first discovered in monkeys in 1958, with the first human case reported in 1970. The virus spreads from animals to humans and between people through close contact, contaminated objects, and respiratory droplets. Symptoms include a skin rash or lesions, intense headache, muscle aches, back pain, and many others. Dr. Simfiri, NRTV News.